Meanwhile, in health, experts in Nigeria have lauded the Nigerian government's approval of 4.8 billion naira to fund for HIV/AIDS treatment in the country, as well as $1.07 billion in financing for healthcare sector reforms under the Human Capital Opportunities for Prosperity and Equity program. Minister of Health Ali Pate announced that the funding underscores the Nigerian government's commitment to providing life-saving treatment and reducing healthcare costs for vulnerable populations. Following the announcement, experts called for increased funding by both private sector and government at all levels in order to ensure an effective and sustainable national response. TV360's correspondent Simisola Adigun has more in this next story.
The financial sustainability of the HIV and AIDS response in Nigeria faces a variety of challenges, including heavy reliance on donor funding that is declining, a low level of domestic funding, and a low level of private sector financing. Just recently, Donald Trump approved a temporary waiver for life-saving humanitarian assistance under the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, a key program for HIV/AIDS treatment in Nigeria and other developing countries, which covers medicine, medical services, food, and shelter, reversing an initial 90-day pause on the foreign aid. This necessitated the approval of 4.5 billion naira by the Nigerian government for the procurement of HIV and AIDS treatment packs to support Nigerians living with the disease.
Even though we have partners that are supporting the treatment, but federal government is already putting its resources to contribute, and we see that that is a signal that the support that the government is providing to those who are vulnerable to reduce the cost and to ensure that life-saving treatment is available.
The Federal Executive Council also established a committee tasked with developing a long-term strategy for funding HIV and AIDS programs domestically. Experts in Nigeria highlight the need for such government-led sustainability efforts to reduce the country's continued reliance on donor support.
I think it's a positive move in the right direction, because now the move is for us to become for us sustainability. We are talking about a new business model in HIV management in Nigeria, so that state actors, government, has a larger role to play in managing this condition, so that we don't have two tracks, one for HIV and then one for other diseases and all. So we're talking about integrating and getting states to have more responsibility.
What has been done, what has been announced, is more like a stopgap measure, just to ensure that, we don't have chaos on our hands over the next 4 months. But if over the next 4 months we do not hear, any significant commitments, from the government, like probably increase in commitments, then we would have a big problem, on our hands. So we want to see significant increment from the government in terms of supporting the treatment program.
The Nigerian government has also announced plans to commence domestic production of HIV and AIDS commodities, including test kits and antiretroviral drugs, before the end of 2025. According to the Director General of the National Agency for the Control of AIDS, Temitope Ilori, the initiative is part of the government's broader efforts to eliminate AIDS as a public health threat by 2030. This move is described as a bold course in addressing funding challenges and protecting Nigerians living with HIV and AIDS.
If we have, the enabling environment, there is power, all of the things that the industry requires to be able to deliver is available, then definitely I believe our pharmaceutical industries can compete, on the same pedestal with their contemporaries in other countries. And we also have a huge market here.
It's important for us to have a wider scope, that funding needs to, for us to eliminate, that's the goal of funding. We don't want HIV, we want by 2030, we want HIV to be, not to be a pressing concern. We don't want it to have the epidemic condition. We want it to have it largely under control. And for that to happen, the 95 target need to be brought to place that 95% of people that have the disease know that they have the disease.
Delivering HIV and AIDS services can become more efficient if management practices are taken into account. These experts press for private sector engagement in the national HIV response in Nigeria. They also emphasize the importance of creating and expanding community initiatives for HIV and AIDS education and prevention, and for the care and support of people living with HIV and AIDS in the country. Simisola Adigun, TV360 News.